So today we're going to talk about loop diuretics. So in first, what exactly are they? Well, in short, they are drugs that increase urine flow, helping the body to remove excess water and sodium, which in turn lowers the amount of fluid flowing through the veins and arteries. And they are commonly used to treat edema, hypertension, and heart failure, but we'll get to that a little bit later. So, how does it do it? Basically, it inhibits the sodium potassium chloride co-transporter in the Henle, which the loop of Henle can be seen right here, disrupting the ion reabsorption and increasing the osmotic pressure in the whole nephron. And this is the whole nephron right here. The lower we go, the closer to the medulla we get, and the higher we go, the closer to the cortex we get. So what does it mean actually, osmotic pressure? Basically, it means the passage of liquid through membrane from a less concentrated solution to a more concentrated. And this prevents water reabsorption, leading to increased urinary excretion of sodium, chloride, potassium, and water. And here we can see the sodium potassium chloride co-transporter in the loop of Henle. This is like a bigger, and this is without any diuretic drugs. I can see it just passes through into the interstitial fluid quite easily. However, when we use those loop diuretics like uh, furosemide, it basically blocks them. Not entirely, but it blocks them, and we'll get to that in a second. So, how much does it actually reduce the reabsorption of sodium, potassium, and chloride? Well, it contributes to 20 to 30% of filtered sodium, potassium, chloride from the tubular fluid back into the blood, which can be enough to reduce edema and swelling in conditions like heart failure, liver disease, and kidney disease. And it can also treat high blood pressure by reducing the volume of the fluid in the body, which then decreases the workload on the heart and blood vessels because there's less volume. And it can also prevent complications like strokes, heart attacks, and kidney problems associated with hypertension. And it reduces fluid buildup, which can reduce symptoms like shortness of breath caused by conditions like heart failure. But there's got to be some kind of downside, right? All those electrolytes not being absorbed back into the body. Well, to give a couple of quick examples, I would call them notable mentions like dizziness, lightheadedness, headache, blurred vision, diarrhea, constipation, loss of appetite, numbness, tingling, muscle spasms, contractions, pale skin, easy bruising, and unusual bleeding. They're basically high blood sugar, kidney problems, liver or pancreas problems. There's a lot of side effects actually, but these are all side effects that doesn't cause necessarily any risk to the health, but these are the main ones. Hypokalemia, which is basically the reduction of potassium, hypotension, which is basically blood pressure being too low, and urinary retention, acute kidney injuries, worsened diabetic control, exacerbated gout, and ototoxicity, which is basically damage to the inner ear. So, because of all these side effects, there are instructions for the people that use this dietary um, dietary, I guess you can call it vitamin, medicine, mineral. Basically, they have to monitor their intake of potassium, magnesium, and sodium, and make dietary adjustments as needed to maintain proper electrolyte balance and prevent deficiencies. And lastly, this is just a final slide, just a recap of what the actual nephron does, where it does, and why it's important.